Welcome, and thanks for the opportunity to brag about nursing. I've been involved with nursing for 35 years, still very enthusiastic, and want to tell you some of the highlights of my career. But first I wanted to give you some information on nursing careers in general, where they're going in the future, since you are the future. As far as the U.S. nurses, right now we have 3 million. The largest segment of healthcare workforce right now. And the RN employment is expected to rise 22% between 2008 and 2018. As far as the new reform, what happened for nurses with that is that $50 million is going to be sent to hospitals to train advanced practice nurses so that you'll have more faculty. The problem with the nursing shortage is not that we don't have enough students. We have a lot of students, we just don't have a lot of teachers. So that will help that situation. In the next 15 years, 124,000 physicians will be retiring. That's 1 in 3 are now over the age of 55. It's bad for doctors, but it's really good for nurses, because nurses are doing more as advanced practice nurses, some of the things that doctors were doing in the past. And when I talk about advanced practice nurses, I'll fill you in on that. As far as nursing degrees, there are 3 ways to go. One is a diploma, which is phased out pretty much now. A lot of the older nurses had a 3-year program. They called it a diploma program. It was mostly in hospital, where you worked as a nurse's aide for 3 years and then you got a diploma. About 50 years ago, we phased into a college-based nursing arrangement, and that gave us the AA degree, and that's something we offer here at Long Beach City College. We also offer a 1-year LVN program, but we have a 2-year associate degree program. And then the other nursing degree that's common is the bachelor's degree, and you would get that at the 4-year school. The difference in the AA degree, which is what we offer here, is that the associate degree is more for hands-on skilled type nursing, and the they also have outpatient, inpatient, things the same as a bachelor's nursing, but the bachelor's is differentiated in that there's more leadership, there's more management, more administration. So as far as the advantage to the nursing degree here at a community college is time, cost, convenience, and practicality. For time, the exam can be taken, which is the Board of Registered Nursing. Once that's taken, you can work as an RN. Cost, it's less costly than the 4-year university programs. And as far as convenience, the community college is a lot of times closer to home. You don't have to go away. As far as being practical, you may not want to sign up for 4 years in something. You may want to go with the 2-year. See if you like it, test the waters. As far as advanced practice degrees, like Masters in Nursing or Nurse Practitioner certificates, those are all over and above the Bachelor's in Nursing, and now they have just since made a new degree called the Doctor of Nursing, and that is what they're trying to start so that faculty can be expanded so that you'll get more teachers involved. Where are the jobs? Okay, right now 60% of the jobs are in hospitals. They expect 17% growth between 2008 and 2018. And these would be in sections like medical, surgical, pediatric, geriatric, emergency room, trauma, cardiac units, mental health, pastoral care, labor and delivery, those kinds of things. Ambulatory care would be in clinics. Doctors' offices expect a 48% growth. That's a lot. Rehab, schools, and university health centers. For me, I didn't know there were nurses in schools. I thought it was the best kept secret. Who knew they even had them? I was in the hospital for 16 years. Long-term care also has a lot of nursing opportunities. Nursing homes expect to be 25% growth. Skilled nursing, Alzheimer's facilities. And then there's some alternate nursing options. Flight nursing, military or civilian. Forensic nursing, which would be nurses that worked with the law and the police departments. Vacation resorts always have nurses. Club Med, some of the ski resorts, summer camps, Ronald McDonald House, Doctors Without Borders, Interplast, Smile Train. These are all opportunities that you can have that are not so traditional. As far as indirect options for nurses, when you're sick of patients, which you might get because sick people are sometimes not that much fun, there's always medical review. There's always legal counseling. So you'll find a job most likely in a lot of these situations. For me, I've been 35 years in nursing, and I came upon it accidentally. I really didn't know what nurses did. I came from a family where no one went to college. My parents didn't even graduate high school. I wanted a job where I could work at night and go to the beach in the day. That was basically what I was looking for, a flexible schedule. So I was looking in the paper and I saw that they had this night shift work for nurses. Well, gee, well, what do nurses do? I had no idea. So I was proactive. I went to a hospital and volunteered. And my volunteer job was wheeling the mothers with the new babies out to the car. Wow, nursing was fun, wasn't it? So anyway, I said, well, I think I could do this. Let me just see. So I stumbled on Golden West College, community college in Huntington Beach here, and I saw a sign that said nursing program applications. And I said, well, why don't I apply? Well, what happened was nursing picked me. I got in their program. I had no idea really what I was getting into, but I liked it. And I figured I'm just going to stay in until they tell me I'm not good enough, because that was my mindset all the time. Just try for it. If you don't get it, okay. Not the worst thing. So what happened was I stayed in. I kept doing well. And when they offered classes that were the 3-unit microbiology as opposed to the 5-unit, I said, well, what are the advantages? Well, the 5-unit, you'll be qualified to go to the university and do this other thing. Well, whatever this was, I didn't know, but I said, well, I'll take the 5-unit, because why would I want to repeat it? I mean, that was my mindset. Why would I take the 3-unit class if a 5-unit was offered? So I ended up finishing Golden West, and apparently was good enough. Started working at a hospital locally, St. Mary's Medical Center. I was in the intensive care unit for 5 years and then moved over to the operating room. And then someone in the recovery room got the measles, and they said, would you go into the recovery room? And I stayed 6 years. So the way nursing is, it's very lateral. Your experience will cross over. So one of the things that got me into the recovery room was that I had the intensive care unit experience. And then when I was in the operating room, there were plastic surgeons that always looked for extra nurses because they needed them for their offices. So I had an opportunity to work for a few plastic surgeons in their office as both recovery and as scrub nurse. Well, why? Because I had that experience. Then, because I had a BSN degree, I ended up going on Cal State Long Beach. I was sitting in the nurses' lounge, and one of the nurses from here, who was an instructor, said, you know, you have a bachelor's degree, and we have a nurse that's going out on a back surgery. I said, yeah, okay. And they said, well, you can teach for us. And I said, oh, okay. So that's how I started teaching. And then I found out that, well, you could teach more and more full-time if you got a master's degree. So I said, okay, well, then I'll just get a master's degree. So, because I liked school, and I kept going. So volunteer opportunities in the community are also things that will help you build a career. Some of the things that I did for Red Cross gave me the experience for the job I have now here at program development and coordinating the health center. And so what I want to explain to you guys, that everything counts. Whatever you do, probably in other things too, but we're talking about nursing here, is that everything will count down the line for something, even if you don't know what it is you're going to want. And I never did. I never knew what I was going to want. And the way I ended up in the doctorate program right now is because I can. And if I can do it, let me just try it. So that was my philosophy. So some of the take-home messages from just my career would be that even if things are challenging and you see them as too hard, do the hard thing. Always do the hardest, because it's going to pay off. You're going to qualify yourself for something where you're going to need that degree or that experience. Always take the high road and take the chance on an opportunity, even if you have the experience of just trying it out. And it just counts as an experience. Many new doors when you are open to walking through new doors, and that's what happened for me. I'm going to just list real quick something cute that I found of 13 reasons to love being a nurse, and then I'll have Monette tell you about her career. We meet thousands of people from every walk of life who need us and want us. That feels good. We're able to move from one end of the country to the other end and still find ourselves in demand. Our profession usually involves physical exercise as opposed to sedentary desk work. We can leave and re-enter the field as our life situation changes. So say you have some family obligations, you want to work part-time, or you can always come back in. Nursing is rarely boring or predictable. We can work part-time or overtime and often get paid to upgrade our skills. A lot of times they'll send you for trainings because they need you in another certain area of wherever you're working. We get to wear scrubs and clogs to work. We're present at life's most momentous events, from birth to death and from crisis to recovery. And we can move laterally into new areas such as research projects, the armed forces, and traveling nursing. A nursing career gives us an inside track on coping with our own or family's health problems. And the results and rewards are often immediate. We are essential to our patients, their families, and their doctors. And according to community polls, nurses are ranked the most trustworthy professional. So, Monette.
Okay, good afternoon. I'm really honored to be here. I really enjoy being a nurse, and I always enjoyed the opportunity to share that with everybody. And Joanne's information about the introduction about nursing was really enjoyable to hear. I was going to mainly just focus on public health because that's where I came from. As my bio mentioned, I'm a public health nursing supervisor with LA County Department of Public Health, Healthcare Program for Children in Foster Care. I would also like to mention my past nursing positions. While in nursing school, I really enjoyed my public health rotation. I enjoyed preventative health and education. But while I was thinking of applying for a public health position at the time, they had told me that I needed to do at least 2 years of acute care facility. So I did that. I did 2 years as a staff nurse at Torrance Memorial Hospital. I realized it wasn't something I enjoyed. I didn't enjoy bedside nursing. So as soon as I did my 2 years, I went into LA County Public Health. I got my first position as a district public health nurse. I did that for about 9 years. And then I transferred to Child Health and Disability Prevention Program. I did that for about 5 years, and then I took a promotion to the current position I'm in as a public health nursing supervisor with foster care. So I've been with LA County for 21 years. I didn't move around. I guess I like to stay in one place. So my current position as a public health nursing supervisor, I supervise nurses and other personnel who provides nursing services in homes and community health districts. This is a general description of a public health nursing supervisor with LA County. The community or population that my program focuses on is with foster care. So for this discussion, I'll mainly discuss foster care. So what's the education and training that's required? The minimum required education and training for entry-level PHN is a license to practice as a registered nurse issued by the California Board of Registered Nursing, a bachelor's of nursing degree, a California State Public Health Nursing Certificate, and specific public health nursing assignments require that you have a driver's license, California driver's license. For my position as a supervisor, a minimum requirement is 2 years public health nursing experience, including 1 year of family-centered agency. Okay, the salary. This is for an entry level PHN. It ranges from $6,000 to about $8,000 a month. As a supervisor, I make about $1,000 more. They always like salaries, don't they? Okay, for the healthcare program for children in foster care, the role of the PHN. Okay, for foster care, it's administered through the local health department or CHDP program to provide public health nursing expertise in meeting the medical, dental, mental, and developmental health care needs of children in foster care. The foster care PHNs, they work in the Children's Welfare System office, and in LA County, it's Department of Children's Family Services offices. So the PHN works closely with the children's social worker or probation officer to ensure the needed healthcare resources are provided. So mainly, the main responsibility of a foster care PHN is to serve in administrative capacity and linking children with vital community services. And this is done through accessing resources. The PHN identifies and liaison with healthcare providers in the community, serves as a resource to facilitate referrals, assist in out-of-county placement, healthcare planning and coordination. They develop and review children's healthcare plans with the children's social worker and the probation officer. They interpret healthcare reports and obtain medical and dental information. They also provide trainings and in-service to DCSF's and probation staff and to the community, or foster care community. They interpret medical information. They participate in multidisciplinary meetings and review healthcare-related issues. They assist the foster care children and social workers in community healthcare resources, and they participate in joint reviews and evaluation and process of data development. Okay, the necessary skills. Critical thinking is a must, and because you utilize all your skills and knowledge acquired from nursing school, past nursing experiences, and even in your personal life when making decisions about a child. You need excellent time management skills and ability to prioritize your caseload depending on the acuity level and the urgency of the case. And collaboration and communication is vital. You need to be flexible because situations can change quickly. The advantages and disadvantages of being a PHN. For me, what I think, advantages now, especially at the climate at public health level, is the autonomy and independence. It's quite evident. Within LA County, the chain of command and the organizational chart is designed so that nursing unit has been able to decide what is best for nursing staff. And the reason why that's come about is because our medical director, who's a physician, and I really respect a lot, he realizes nurses need to make nursing decisions. So he's allowed our organization to do that, or our nursing staff to do that. Career opportunities within LA County Department of Public Health is very good. There's many job opportunities all over the county and with different programs. Like I mentioned, just foster care program in LA County. There's about 18 other different types of programs with LA County Public Health. And there's also 13 different health centers in LA County. I'm off weekends and holidays, which I really enjoy. There's no night shift, there's no evening shift, there's no, I guess there's overtime if you really need to, but it's very limited. Disadvantages, patients may not appreciate services provided. If a PHN goes out with a social worker on a case and the social worker at that time decides to remove the child for whatever reason from the home, a lot of times they don't want to cooperate with the nurse, because they're upset and you don't blame them. And another disadvantage may be the 9 to 5 hour workday. Like mentioned earlier, she liked to go to the beach during the day. Well, if you work during the day, you can't go to the beach. So that's one of the disadvantages of being a PHN. You work, it's a 9 to 5 workday. If you have, I know for me, having a child, sometimes I need to take time off to pick her up from school or whatever. So that's kind of a slight disadvantage. Advantages. Well, like I mentioned earlier, the minimum requirement is a bachelor's degree. So you need to have a bachelor's degree to be a public health nurse. So advanced degree, as far as a master's degree, is not required. But since the job market has really been competitive, there's some flyers that say a master's degree is highly recommended or recommended. I think the only time they really recommend a master's degree is at the nursing director level. Advancement is pretty good, and again, considering the unemployment problem, there's definitely investment opportunities. There's just not as much. I know with our program in foster care, we just hired 2 nurses, and it seems like every so often we have positions open, mainly because nurses either move on, transfer for other opportunities. The promotion opportunities are really good. There's supervisor's level, that's at my level. There's program specialists, nurse manager, and nursing director. What I think that is dynamic, that nurses are advancing to so-called non-nursing positions. Like mentioned earlier, there's nurses who are hired for positions that were usually filled by physicians, which I think is really exciting. They realize that nurses can also do the same as far as administrative levels as physicians. And I guess that's it. I really enjoy being a nurse. The community, I went into public health because I enjoyed advocating for communities. I came from a lower income community. I always wanted to give back to that community. And I always felt that public health was a way that I could do that. So thank you.
So now we're going to have Dr. Richard Zapanta. Right after Dr. Zapanta finishes, then we'll have the questions and answers.
Thank you, Javier. First of all, I'd like to thank Javier and Debbie for arranging for this career panel in health. I think it's very, very important. I could remember maybe a long time ago sitting in where you're sitting now. Quick question, how many of you are high school students? How many attend Long Beach City College? Okay, so about 50-50. You know, what I've been asked to do is to give a talk, and I've entitled it, Student to Healthcare Provider. What I'd like to share with you today is a brief description of my background, and I'd like all of you to kind of sit back and just listen, maybe to relate to where you're at and what I did in the past. You don't have to take notes. There's no need to take any notes. You're not going to be quizzed on any of this. So I'd like to give you my background, my educational journey, including my experiences in junior high school, through medical school, my residency training, and my long-standing relationship with USC and my commitment to the Hispanic community. I'm hoping my talk will inspire and stimulate you to remain passionate about pursuing an education and giving back to your community. Like many of you, I came from what I would consider an upper-lower or lower middle-class income family. My father was an auto mechanic who worked for a single Buick dealership throughout his career. Years later, he would describe himself as being a doctor of motors. My mother was a housewife, but a perpetual student. Both of my parents were born in East Los Angeles. My father graduated from high school. My mother was a high school dropout. She couldn't complete high school, but years later, when I actually was in junior college, she went back to school, got her high school diploma. She became an LVN and RN, and ultimately graduated from Pepperdine University. I could never recall lacking food, clothing, or shelter, but learned at a young age that my family lived within a budget, and there were many things that we could not afford. I can recall weekend family rides to residential areas in Beverly Hills, looking at the large homes and mansions and fancy expensive cars, and dreaming what it would be like to be rich. Like I said, I was born and raised in East Los Angeles. I'm a fourth-generation Mexican-American. I attended public schools in East Los Angeles from elementary, junior high school, and high school. I attended Garfield High School, which at that time probably had the highest dropout rate in the city. And unfortunately, I don't think things have changed very much since that time. In my mind, I was kind of stuck between two cultures, not truly accepted as a quote-unquote an American because of my skin color and where I was raised in East Los Angeles, but not accepted as well as a Mexican because of my lack of knowledge of Mexican history, true culture, and language. This was a dilemma that as time went on, I worked through that. During my years at Griffith Junior High School and Garfield High School, I was very active in student government. I was class president, the president of the high school. I excelled in athletics, ran cross country, played tennis, and academically did above average. I do recall, however, when I entered Garfield High School, counselors advising me to take auto mechanic classes. Now, if it hadn't been for my mom pushing education, I would probably be an auto mechanic. However, because of that, I started taking college prep courses and graduated from Garfield High School. From there, I went to East Los Angeles Community College, similar to Long Beach City College. I think attending a community college allowed me to develop a good foundation and a sense of direction, as well as the opportunity to develop good study habits before transferring to USC. I totally agree with President Obama, who calls community colleges unsung heroes of America's educational system. They may not get the credit that they deserve and may not get the same resources as other schools, but they provide a gateway to millions of Americans to good jobs and a better life. I cannot say enough about community colleges. Here at Long Beach City College, those of you that are here now, I think this is a time for you to really take advantage of getting a good education. It's a stepping stone for you to graduate and go on to a four-year university. You get to take the same courses, get the same credits, but obviously the finances are much more reasonable. Reflecting back, a lot of things influenced my life. When I was growing up in the mid-'60s and early '70s, it was a time of civil rights movements. There were, in East Los Angeles, high school walkouts, Cesar Chavez and the farm workers' boycotts. Reflecting back on all of these events seemed to have shaped and influenced my outlooks towards life and opened my eyes to the disparities and inequalities that existed in the community that I was raised. High school dropout rates and low to no enrollment at major universities resulted in the lack of Hispanic professionals and other underrepresented minorities, and this was not more evident in the health professions, but especially in the field of medicine. Rather than considering myself a victim, I became more inspired and determined and committed to combat the challenges that lay ahead. I knew from a very early age that I always wanted to be a doctor. However, as many of you sit out here today with your dreams and aspirations, there's obviously going to be a lot of obstacles and challenges that you need to overcome. When I finally graduated from USC, my grade point average at that time was 3.25, but I think more important, I had a burning desire and determination to pursue a career in medicine. After graduating from USC and applying to medical school the first time, I was not accepted to any medical school that I applied to. Being depressed and obviously saddened, but I think my mom was more so saddened than myself, seeing me have to deal with this rejection. I had several choices. I could have simply given up and gotten a job and say, forget about school. One thing I did look into is possibly attending a medical school out of the country, a foreign medical school in Mexico, Guadalajara, or possibly in the Philippines, and I actually looked into medical schools in other countries. Another option I had was to change my hopes of becoming a doctor and possibly going into social work, teaching, criminal justice, all very respectable professions. And my fourth option, probably the least desirable, was to join the military. At that time, there was the Vietnam War, and so that probably wasn't a good option, even though I seriously thought about it. While I was thinking about it, and after having graduated from USC, I was taking a chemistry course during summertime at UCLA. Feeling quite desperate and really with nothing to lose, I made a bold decision in action that probably was the single most significant event that shaped the rest of my life. I scheduled a meeting with the Dean of Admissions of UCLA School of Medicine. His name was Dr. McKee. I pointed out to Dr. McKee that of UCLA's lack of Latino medical students or their recruitment efforts, especially this being a state-financed institution. I literally pleaded with him for the opportunity for admission to medical school, insisting that if given the opportunity, I felt confident and capable of competing and being able to graduate. He obviously was quite skeptical and quite dumbfounded. However, I think back now, and in retrospect, I'm sure he respected my forwardness, passion, and determination. After he was bidding me farewell from his office, he thought for a minute and told me that there might be an opportunity. It just so happened that the week before, there was a Dr. William Cadbury from the National Medical Fellowship back east who had come to UCLA on a recruitment mission. Again, this was a period of time that universities were looking for recruitment of underserved communities. This especially was being pushed by the government, universities, and especially from within our communities. After contacting this individual, I participated for 1 year in a post-baccalaureate fellowship at Haverford College, which is outside of Philadelphia. Upon doing that, UCLA gave me a conditional acceptance, provided that I go through this 1 year program, which I did, and I did reapply to medical schools, and I actually applied, besides UCLA, I applied to UC San Francisco and USC. USC, University of Southern California, had always been my #1 choice because of its reputation and training opportunities, but especially with the medical school being located in the largest urban concentrations of Mexicans outside of Mexico City. A good chance for me to give back to my community. Thus, I started USC School of Medicine in September 1969. Medical school is 4 years of medical school. You start off with your basic sciences. Those of you that have an interest in the medical field, whether it's nursing, any of the fields, you basically have to take some basic sciences, whether it's anatomy, biochemistry, pathology, pharmacology. You have to take all these, obviously, to learn about how the body functions, the physiology and treatment of disease processes. During the first year at USC, however, you had the opportunity to actually come in to have patient contact the first year. Most medical schools don't have that, and this program is called Introduction to Clinical Medicine. That, going back when I was back in medical school, that was the first year that a program such as this had been initiated, and now many medical schools across the country actually have a program such as this. In my situation, probably one of the greatest influences in my life, besides my parents, was my elder and only brother. His name was Edward Zapanta. He was 8 years older than me, much more studious, and a trailblazer in his own right. Like myself, he attended local public schools in East Los Angeles, as well as East Los Angeles Community College. He became a doctor, graduating from USC School of Medicine in 1963, completing a neurosurgical residency, that's a brain surgeon, and became a prominent Hispanic leader in our community. He was the first Hispanic to serve on the USC Board of Trustees and also served on many other corporate boards such as Southern California Edison and the James Irvine Foundation. My brother passed away about 8 years ago, but in his name at USC, they have a scholarship in his name that for a medical student that exemplified my brother's high academic standards and concern and commitment to the Hispanic community. As I mentioned earlier, I often wondered what it would be like to be rich. Thanks to our parents, my brother and I learned at an early age the richness of compassion and caring and helping those less fortunate than ourselves. We were all taught, like I'm sure most of you are, that to be successful requires hard work and sacrifice. I cannot emphasize enough to you today that you need to stay focused and motivated. Anything worthwhile, anything you do in life, takes time and effort. The easiest thing to do is to give up. It was said earlier, you have to work hard. You saw what nurses make, the salaries they make per month. That's a lot of money. but you have to work for it, you have to go to school, nothing's going to be given to you. If you don't succeed the first time, like in my situation, I could have easily given up, but I was persistent, no matter what it took. Just like I was talking to this young man, Jonathan Maldonado, in the break here. You know, he came up to me, which takes, you know, not easy to go up to somebody you don't know, and he expressed his interest in working at, volunteering at my office. Things like that, you have to be forward. There's nothing like a dumb question. There's no dumb question. You can't hold back. You have to be forward, and if you're really interested in whatever you're interested, you just really have to pursue it and give it your full effort. Now, getting back to my training, after graduating from medical school, I did what's called a straight surgical internship. I was interested in surgery because of my brother being a neurosurgeon. I thought I might be interested in going into neurosurgery, so I sought the surgical field. So you do an internship, that's a year of training, and in my situation, a surgical internship means that you rotate either for 4 to 6 weeks through the different surgical subspecialties, whether it's orthopedic surgery, neurosurgery, cardiovascular surgery, urology, ENT, so you rotate through that year. During that year, you know, I had been interested in neurosurgery. However, during my rotation through orthopedics, I really developed a liking for orthopedics. And because of that, and while I had thought of going into neurosurgery, I did not apply to the program. Therefore, after completing my straight surgical internship, I did a 1-year neurology residency. Neurology is the field of the brain, the spinal cord, the nerves. So this was a good introduction for me after that 1-year neurology residency to do before I started my orthopedic training. I completed my 4-year orthopedic training. I did all my training at LA County USC Medical Center. Do you all know where that is? It's near downtown. They have a new hospital now, but at one time it was the largest teaching institution in the country for training of nurses, doctors, all the allied health professions, respiratory therapists, physical therapists. They have all these programs there. You know, so I went through that training there. The 4 years was a grueling period, working long hours, but having the opportunity to the vast clinical exposure that a county hospital has. As mentioned, besides going through the LA County USC Medical Center training program, you rotate through Rancho Los Amigos, which isn't too far from here, in Downey. It's probably a world-renowned rehabilitation center. I've also had the opportunity to do training, a good half a year of training at Children's Hospital in Los Angeles, dealing with orthopedic conditions in children. Once I completed my orthopedic training in 1979, I had several options. I could have easily opened up an office or joined a practice in Newport Beach, or gone to Beverly Hills, Pasadena, where, you know, the communities are upper scale. However, I'd always wanted, and it was in my plans, to come back to the community where I was born and raised and to give back to my community. So what I did, I opened an office in East Los Angeles, Montebello. To open an office isn't easy. These are things you aren't trained in during medical school. Had to go to the bank, I had to borrow a lot of money. Before I talk about that, how much money did it cost me to go through medical school? That's very, very expensive. You know, most of it was paid by my parents. My dad, as I mentioned, was an auto mechanic, but he was a very wise, frugal person that saved money and, you know, watched how he spent it. And so besides scholarships, the majority of my education was given to me by my parents. So anyway, when I went to open my office, I'm on my own now, so you have to go to a bank, you have to borrow. I vividly remember I had to borrow $50,000 to get started. First of all, you have to find an office, you have to pay rent, you have to find a place, sign a lease, you have to buy all the furnishings that go into a doctor's office, from tables, the waiting room, all the supplies that are necessary, hiring the personnel. I remember I hired a front office girl, and And actually, my mom was a nurse at that time, so she kind of helped me out and worked at the office with me when I first started my orthopedic practice. So it took a while, but I was back to the community that I was born and raised, and shortly thereafter, I had a very busy orthopedic practice. 8 years later, I had a doctor join me. His name was Dr. Tomas Salcedo, who is still my partner now. We've been together for more than going on 25 years. He also, trained at USC. He was born in Durango, Mexico. He came to the United States, actually Boyle Heights, East Los Angeles, at the age of 13. Went to Roosevelt High School, which is a public school. From there, he went to UC Irvine. From UC Irvine, went to USC Medical School. So this goes to show you that if you have the desire and wish and you're willing to put the time in, anything is possible. All of you sitting here today, you all have the capabilities of fulfilling whatever your dreams are. It's just a matter of being persistent, giving your full effort. Again, anything worthwhile is going to take time and effort. And if I leave you with one message, I just want you to remember, the easiest thing is to give up and forget about it. That's what you don't want to do. If you have your mind and heart set on something, just pursue your dreams to the max. Give it all you have. Short of that, I think that's all I have to say.
Thank you, Dr. Z. Thank you, John. And thank you, Monet. We're going to go into our next segment is for the questions and answers. And what we're going to do is, Antoinette, can you join me up here for a second? We're going to do questions and answers. And one of the things, real quick, that I want to iterate that Dr. Sapantas mentioned was that he had a student approach him and ask him about his careers. Today you have an opportunity to meet and talk to three great individuals. Don't be afraid to ask any questions, because you never know where it may lead. And I know it's a very common phrase, but there's no such thing as a stupid question. Please just ask. These individuals are here because they truly want to give back, educate, and support you guys. So whatever's on your mind, feel free to ask. And so with that said, I'm going to pass out the mic, and so for those of you who want to ask questions, feel free to just to come up in the front rows between the rows here, or I'll see if I can go reach you with the portable mic. Questions? Like that? All right.
I have a question for either one of the nurses. I'm an older student returning to school, and I find that I'm having a lot of problems with my feet and some physical issues. I used to work in the dental industry, and I was wondering if there's other opportunities in nursing where you're not on your feet all day, or if I don't become a nurse first, can I go into healthcare administration?
If you wanted something working with patients, a lot of times there are intake nurses in different areas where you'd be sitting with patients and doing intake and consultation. That's one area. If you decide patients are not what you want to do and you want to still stay in the medical field, there's a lot of jobs that have to do with documents and consultations and looking at legal papers and that kind of thing. So I guess it would depend on if you wanted patients or something more of a clerical type situation, but nurses are needed everywhere.
And to add to that, I have a friend who's a nurse, and she worked in the hospital for, I don't know, for 10 years. She came down with arthritis, and due to that, she became a public health nurse, where you don't do a lot of walking, you do a lot of paperwork, you sit down, work on the computer. You have some patient care depending on the program that you work with. But like she mentioned, yeah, I know some people went to utilization review, and just pretty much as a desk job.
Other questions? Let me ask one then. One that I get a lot from students, and I'll start off with. I have one for the nursing and one for the doctor. Let's start for the doctor. One of the biggest questions that I get from students is, what's the best route to go to get my undergraduate degree? Do I have to be pre-med? Do I have to go biology? What do you recommend?
Yeah, very good question. In my situation, I knew I was interested in medicine, so when I went to East Los Angeles Community College, I started taking my prerequisites for medical school. When you apply to medical school, there are certain prerequisites, certain classes that you have to take. You have to take your chemistry, you have to take your physics, you have to take calculus, I think microbiology, and there's probably a couple others. So at East Los Angeles College, I took my chemistry, Chem 1, Chem 2, I took Physics 1 and Physics 2, but you don't have to major in a science. In my situation, I majored in psychology. I'm on the Board of Admissions of the School of Medicine at USC, and in fact, we started this week going through applications. For instance, at USC, for 174 positions, 6,000 people apply. So it's very competitive. But we look at, medical schools look at an individual, not strictly at their grades. Their grades are very important, but it depends on other factors as well. You have to take what's called an MCAT. It's a kind of an aptitude test, your grades. But more important, they want a person that's well-rounded, somebody that's going to maybe have an interest in music or whatever, art. So we want a well-rounded person. So to get to your point is, you don't necessarily have to major in biology. It could be history, it could be psychology, it could be art, but you have to take the prerequisites that are required of any medical school.
And to piggyback on the nursing, because I get this a lot from the nursing, is that students always ask me, do we have to have an associate degree to get into the nursing program? That's one of the bigs. Do I have to take all these general courses?
Depends on the route you want to go to. If you want to go directly to a bachelor's in nursing program, no, you don't. You do have to take the prerequisites to get into a nursing program. You don't have to necessarily major in nursing yet. In fact, it's probably a disadvantage to major, especially if you want to go into Long Beach State because it's so impacted. I had a friend's daughter who majored in pre-nursing, and because she majored in pre-nursing, she didn't get accepted to Long Beach State. Her grade point average was, I think, a 3.6 or something like that, and she didn't get accepted. So what I suggest is that you don't major in nursing if you are interested in nursing. Just take the prerequisite courses. Make sure your grade point average is pretty good. I don't know what the grade point average is now, but back when I was there, it was like 3.8. So what I did, since Long Beach State was so impacted, I took all my prerequisites. I took some prerequisites with the city college level too, and I applied to different colleges. Mount St. Mary's is where I got accepted, but I know Long Beach State, for me, if I was to stay at Long Beach State, I would have had to wait like another a year or two to get accepted. But that's what I did.
For the two-year nursing degree, you do need to get an associate degree, because to get your board certification, you need to have completed that. As far as going straight to the bachelor's degree, I agree with Monette. You need to get the prerequisites done. I also am a strong advocate for community service. I think that they look at that in any application, and yeah, I could not say enough about learning how to read and write. You really need those basic skills to get into any program, not just healthcare. You are going to read and write with whatever you do, and just get really proficient at that.
We have questions up front. Margaret, we come right over here.
Hello? Okay, I plan on becoming a physician assistant or anesthesiologist, I'm not really sure. But my question is, would it be a good idea to be in a nursing program first and like have that experience to become a physician assistant or like like some type of a doctor, or should I just take my generals and then transfer and like get into a program, or I don't really know what to do.
And you're here at
Yes.
LBCC right now?
Yeah, this is my first year.
First year. Yeah, with physician assistant programs, there are different programs here in Los Angeles County. There's one at USC, there's one at Charles Drew, and I think there's one at UCLA Harbor. You know, what I would suggest, I think first of all, you have to get information of each of the PA schools, physician assistant schools, and see what the requirements are. And you know, you don't necessarily have, you don't have to become a nurse first to apply to PA school. You know, if you're interested in PA school, I think you have to, they'll at least have a bachelor's, so you probably have to get your bachelor's degree first. Now, you're interested in anesthesiology, you said, right? Anesthesiologist?
Yeah.
If you're interested in anesthesiology, you have to go to medical school first. You go to medical school, and then after medical school, then you do your residency in anesthesiology. I think that's another couple or 3 years. So that's completely different than from PA school, from PA, physician's assistant. So briefly, I think you have to get information from each program, PA program, and see what the requirements are. But if I'm not mistaken, you need to have a bachelor's degree before you apply. But you don't have to be a nurse first to apply to a PA school.
Okay, thank you.
I saw some other hands right behind.
Before, I didn't know what the difference was between an associate's degree and a BSN, but you cleared up for me that basically there's more administrative and management courses that's required. I was wondering how much more schooling and what kind of schooling do you need in order to become an RNA, a registered nurse anesthetist? What's required?
Okay, that would be a nurse anesthetist is a master's program, and they have, I'm not sure if Cal State Long Beach has a program, nurse anesthetist, but it is a master's in nursing, and then that would be the focus. And I don't think you are a nurse practitioner. I think there is a certification for nurse anesthetist, and the requirements for that would most probably be a lot more chemistry, because you're going to need to do that. But I think 65 to 70% of all the anesthetics delivered in our nation are by nurse anesthetists. So it is a very good career path if you can, you know, go with all that chemistry. It'd be good for you.
For us high school students involved in medical programs, what colleges or universities would you recommend us to apply for?
Javier. A lot more financially affordable. You know, 2 years, and then you could transfer to a 4-year, university. My situation, 2 years at East Los Angeles College. Unless you're just exceptionally smart and you're going to get a free ride to go to a major university, going to a four-year university can be very expensive. And unless you're just really, your grade point average is exceptional, then they might consider you for a full scholarship. But the likelihood of that isn't very likely. So I usually recommend, and again, like I said, I'm very proactive about community colleges.
I do. I have more to say. On the community college, I support that totally, and one of the reasons is that it is the least investment of your time with the greatest output. Supposing you did a 2-year degree in nursing, took the state board exam, passed it, you are now an RN. You can work as an RN. You can see if you like it. What if you don't like it? Then you've invested 4 years into something without having worked in practice. And there are many, many programs that you can go from a 2-year RN degree to a 4-year degree while you're working. There are many programs that have online components to get a bachelor's degree. There are many that have classes nights and weekends to make it more convenient so that you can continue working. So I would go with that for the cost, because it's cheaper, and also because it's more bang for your buck. You could see if you like it. If you don't like it, then you've wasted time. The other thing I would recommend, and I've talked to students about, applying to more than one community college nursing program. We have a very impacted program because we're shy of few instructors, and there's a waiting list. I'm not sure how it works. It's not my area here, but apply to some of the local colleges all over, because somebody's going to let you in, and then you won't have just narrowed your, I only want to go to Long Beach City. I mean, shouldn't be saying this, but you know, I want you to get what you need. And if you can get into Cerritos quicker, they have a perfectly fine program. I went to Golden West, it was a perfectly fine program. Any two-year program, you can check their graduation rates and their RN board numbers to see, well, how many passed the RN board that have gone through here? Oh, only 60%? Gee, I don't think I want that school. So you'd have to do your homework, but I would recommend community college totally before making that investment.
Quote another one.
Well, as a high school student, I already know what I want to major in, so it's basically in sports therapy, but sometimes I get confused in where to go. Like, I want to go to a 4 years straight, like I have my mind set on that, but then I get told that the money and stuff like that, so I'm not pretty sure which will be the best goal for me. So if there's like any goals that you guys would consider.
Again, I think it's the same issue we're talking about. Just like Joanne said, you get your bang for the buck coming to a 2-year community college, whether it's Long Beach City College, Cerritos, Golden West, East LA College. You know, if I were you, I have 5 kids. My 2 daughters, I sent them right from high school to 4-year schools, USC and University of San Francisco. If I had to do it all over again, I would have sent them to a junior college first. It would have been a lot less financially stressful, save money basically for the same education, and they could have transferred afterwards. So again, I'm getting back to the same point, but I'm all in favor of community colleges, and I think that the country as a whole sees the benefits of a community college, putting out the workforce, being able to, getting them started in the workforce, developing a trade, going into nursing, sports therapy, whatever you want to go into. I think it's a great opportunity. I'm not saying there's nothing wrong with going straight from high school right into, say, to USC. That's fine if you could afford it, if you're getting a scholarship, then in that sense, that's fine. But I think for the average person, and I would strongly recommend a community college.
Hi, my name is Mrs. Kostenbader. I'm lucky enough to be the teacher to a lot of these kids. I don't know if a lot of them actually know what a daily routine would be for a professional nurse or a professional doctor, any profession in the medical team. So I was wondering if maybe one or all of you could just say a very quick synopsis of a typical day. If there is such thing as a typical day.
What I did today's what, Wednesday. My routine Wednesday, I got up early this morning at 5:15. I was in surgery at 7 o'clock. I did a total knee replacement on a patient. I would have operated all morning this morning, but I had this commitment, which is a very important commitment, to be here with you. So I would have been in surgery. I would have done about 4 or 5 surgeries. I would have been done hopefully by about 1 o'clock. And this afternoon, I'm going to be in the office all afternoon from about 1:30, 1:45 until about 5 o'clock, seeing about 25 to 30 patients. Tomorrow, patient day, I see patients in the morning. I'm going to see probably about 20 patients the afternoon, the same number. In my situation, I'm an orthopedic surgeon. Does everybody know what an orthopedic surgeon is? Orthopedic surgeon is a doctor that takes care of, it's a specialty of medicine that takes care of people that have musculoskeletal problems, problems with the bones, the joints. So anybody that's broken their their leg, their femur, their wrist, if they've injured their shoulder, if they've torn their knee up by sports injury. So I take care of problems like that, or people that have bad arthritis. I'll put like an artificial knee or an artificial hip in their joint. So that's what an orthopedic surgeon is. And I take care of individuals from kids, the 1, 2, 3, 4-year-olds to very elderly people in their 90s. So it's a day, I'm used to doing this day in and day out. Other things that orthopedic surgeons do, somebody gets in an accident, auto accident, where do they take them? To the hospital. If they have an orthopedic problem, if they have a broken bone or something, the emergency room doctor will call whoever the orthopedic surgeon who is on call to take care of that individual. So in my situation, each day of the week is already planned. So Monday mornings, operate in the morning, patients in the afternoon. Tuesday, I'm in the office all day seeing patients. Today, Wednesday, surgery in the morning, patients in the afternoon. And then Thursday and Friday, patients as well. And then sometimes over the weekend, if you have somebody in the hospital, I have to go visit them to see how they're doing. If I've operated on them and they're still in the hospital, we have to see them while they're in the hospital.
Well, my day is not as exciting as that. I work what they call a 980, so I'm off every other Monday. I work from 9 to, not 9, I'm sorry. I work from 7:30 to 5 usually. And it's mainly, since as a supervisor, the nurses I supervise they consult with social workers on the healthcare needs of foster children. So I just make sure that the nurses, or ensure that the nurses are able to do that type of work by administratively. I look at their caseload. If it needs to change, I'll do that. I attend lots of meetings, making sure policies and procedures are being followed. But it's not all that exciting. It's like, during the week, I'm off weekends, so I'm not on call, so I can go home at the end of the day and not worry about work.
It's hard because there's really no typical day. Okay, the position that I have now here at the college is mostly developing programs. So I walk around and I notice too many of the students are smoking. So I say, okay, well, what can we do about smoking? I notice the students are eating chips and they're not eating fresh vegetables. Well, maybe we should do something about nutrition. So there's a lot of professional leeway in this job because my original hire was make a health center here. So because I had worked at Dominguez Hills in the health center, I knew what health centers were supposed to look like. So I sort of went with what kind of a model that was. My work at Dominguez Hills, I was a nurse practitioner, so my day was more or less more on a schedule with patients having appointments, and what I would do was physical exams, a lot of women's health, a lot of education, episodic illness. So someone comes in with some kind of an illness, I'd figure out what medicine they need, I'd figure out what other self-care they need, and do that. My jobs in the hospital were more structured because you're working more of a team. You have, for when I worked in the operating room, a lot of it was getting the surgeons what they needed, making sure it was there, making sure that it was the right patient. That's always a problem. Making sure for an orthopedic surgeon we had the right leg that they were operating on. It was a lot of, paying attention. It was a very critical area. In the ICU, things were more non-typical than ever because what would happen, you'd walk in and there was a patient just eating breakfast. Hello, how are you? You think he was transferring out. You go and check his chart. You do something else. The next thing you know, you look at the monitor, his heart had stopped. Well, that changes your day because now you're coding him with all your other team members and you're trying to keep the person alive. So it depends on the place. In the Student Health Center, we see many, many variants of all of it because students are all ages, they have all kinds of pre-existing conditions. A lot of our students don't eat at all, and they wonder why they're feeling sick at 3 in the afternoon. I mean, that's just one thing. So there's a lot of education that goes on here, but there is no typical day for nurses as far as I know it. Sorry.
With the healthcare reform, is there any changes to be expected from a career standpoint for nurses and doctors?
A lot of money is going into nursing education for faculty so that we can open up a lot more nursing program spots for students. And now a lot of the insurances are covering people longer, like you can have a child 26 of age, so a lot of those kinds of things. But for nurses, it's actually working out very well. I'm not sure for doctors.
First of all, the situation we're in right now, there is a significant shortage of doctors that are going to be able to take care of patients in the next 10 to 20 years. So I think with this health reform bill that was recently passed, there's going to be an emphasis on increasing the number of people have the medical schools try to increase the number of doctors that they could produce. Obviously, they're not going to be able to keep up. So I think a lot of the nurses, there's going to be nurse practitioners, nurse anesthetists. These individuals can do a lot of things that doctors do now. So there's going to be a need. So I think besides doctors, there's a push to increasing the allied health forces, which includes nurses, respiratory therapists. So I think this health, to put it in a nutshell, I think there's going to be a bigger opportunity for those of you that are interested in the medical field to pursue that. Because the government, we're going to need doctors, nurses to take care of me in 20 years, 15 years. And if we don't have the doctors, there's going to be a significant shortage. So I think in regards to that health reform, I think that's hopefully going to be addressed.
Another question in the back.
Hello. Hi, good afternoon. My name's Matthew Kalima. I currently attend Long Beach City College. I plan to be a nursing major, but I was wondering, this question is directed to Dr. Zapanta, I believe. I said that right? Okay. I was curious, during your speech, you explained how you, after going through all that schooling for your bachelor's degree and you got rejected from the applications to medical school, what made you keep going? I find myself at numerous situations where I fail tests or don't get accepted to the place I
know
want.
exactly what you're saying, because I was there just like you. There's, just like I said, there's going to be, we have aspirations and dreams, but not everything's going to work out the way you want it to. Even though you've studied hard for an exam, you've tried your best, you might not do as good as you were anticipating. But again, I think the easiest thing to do is to give up. I could have easily given up. That's the easy thing to do. But I think if you are really determined to accomplish something, you just have to stick with it. It's easier said than done, but that's what it takes. I look back and see a lot of my friends that were smarter than me. They were really smart, but they were distracted. They didn't pursue what they should have been doing. And I look at them now, and they're, didn't really become successful. They should have. Again, a lot has to do with your motivation and determination. And all I can tell you is just don't give up. Things aren't going to always work out the way you would like them to. Even though you've worked real hard to prepare for a certain exam or whatever. Again, these are the obstacles. This is going to determine who's going to make it or who's not going to make it. There are going to be a lot of people in your situation that they're going to say give up. They're going to give up. But it's that individual that's going to continue, that's going to eventually become successful. Whether you get into nursing, and I was talking to somebody earlier, I think, say you want to become a doctor. Obviously, not everybody's going to become a doctor. But if you, like Joanne said, if you shoot for the highest, if you try your best, there's going to be other things. There's so many things in the field of medicine to do. Not everybody's made out to be a doctor. But we talked about nurses, there's physical therapists, respiratory therapists, dentists, veterinary medicine, there's all kinds of things. So all I can tell you is just continue trying your best and don't give up.
One more question, please. So then, do you believe determination is better than intelligence, or what?
Better than what?
Do you believe it's better to have determination than intelligence, or
Intelligent? No, obviously intelligence is very, very important, right? That's,
Of course.
That's needless to say. But I think it's, just like I was saying, I knew a lot of my friends that were very intelligent, a lot smarter than me, but yet they did not focus their efforts on positive things, and they did not become successful, which they should have. So I think basically it's a combination of both. You know, just like I told you earlier, I'm on the admissions committee of the medical school, and we see thousands of applications. And again, some people are applying for the third time. Then we start looking at these. This guy is really, this young lady's really, you know, motivated. She's done community service. She's volunteered. You know, her grades might not be that good, but she's just really determined. And this is the kind of person I think, you know, medical, at least at USC, that's the type of person they want. They see that determination, and you know, they're not giving up. And you know, I see that on the admissions committee. But obviously, it takes, you have to be intelligent as well.
Thank you.
Thank you. I think we're set for questions. At this point, I'd like to thank Joanne Tyler, Monet, and Dr. Zapanta for coming and speaking to our students here at Long Beach City College. On behalf of Long Beach City College, we'd like to give you guys a little gift. But before you guys leave, you know, Dr. Zapanta has to be leaving. But we're going to ask you guys one thing, is you guys were all given an evaluation form for this panel. Please fill that out, and please make sure you turn that in on the way outside. That's very important. Let us know what you guys want to hear next time. How can we improve? The reason we do this is for our students, and so make sure you guys put down your most honest opinion. And for the next 5 minutes, if our guests don't mind, I want to give students the opportunity to personally come and introduce themselves to our guests, and so you can get to know them, and vice versa. So with that said, make sure you turn in your evaluations, and feel free to come introduce yourself to our guests in the front panel. Thank you again.